So Chandler, thanks for coming. I really appreciate you being here, and it's been so good to work with you. How many years has it been?
It's been just over 4 years now.
We do a lot of cases together, and then you're now really the team lead for all of neurosurgery at the hospital.
Yeah.
And just have done a phenomenal job. In our rounds discussion, we talked about patient safety. And how do we continue and have a positive, good safety culture in the hospital and especially in the operating room?
I feel like the best way to have our safety culture is to come together as a team.
Yeah.
When we all are working towards the same goal and have the same plan in mind, that the patient's coming first and their safety is our top priority, then when we all work together, that's how we're going to be better at it.
Yeah.
When we talked about this the other day, that if one person's making a movement consistently towards a certain goal and other people see you doing that, they're going to start to follow at some point. If they see and say, what she's doing, that makes sense. So if we all start just doing that 1% more of working towards safety, we're all going to start to come together and it's going to be better.
Yeah. And I appreciate your leadership in the team, because to have someone like you come in and be very focused on that, I found and seen that other people follow and they're like, well, yeah, that's what I should be doing too.
Exactly.
And I'm so glad we have Cruz here today.
Cruzy, can you tell Dr. Edwards hi? No.
If Cruz were to be heading into surgery, what would you expect the operating room team to be?
I'd expect them to be top notch. I'd expect the A team. I'd want them to be thinking about what was best for him the whole time.
Yeah.
I wouldn't want them to have other things on their minds. They'd want to be, I'd want them thinking about my son. And that's how I try to feel with my patients. They're someone else's family.
It's always somebody's loved one.
Yeah.
Somebody's son or daughter or loved one. And I think it's so good that you have him here, because it's sort of this reminder that we are caring for a person that many people care about.
Exactly.
And we need to do everything we can, not let our egos get in the way, but have a culture of safety.
Exactly.
So appreciate the example that you've set there. And I feel like we've never been in a better place as far as the culture of safety goes in the operating room. How do you feel about that? I
agree. I mean, we've got great team members that are all willing and focused to work towards safety. And we've also got great management and leaders that are there to back us up. So if something does happen, or we need to speak up because something isn't going the way we'd like it to, they're there to back us up.
Yeah.
They're there to talk to us and be on our side, that, safety's coming first for these people and for our team.
I love that. Well, thank you so much for coming. And Cruz, thank you
You're welcome.
And I think it's wonderful again to have him, because our whole goal here is to have a loved one of someone's.
Yeah.
And each patient that comes through, to get our very best effort and to have surgery and other medical care performed as safely and effectively as possible.
Yeah. Well, thank you for having us. And it's nice to have physicians that are as dedicated to safety as you are. I appreciate it.
Thank you.
Yeah.